I'm Ayele. I'm one of the health educators here at Mary Center. And today I'm here to discuss COVID and the vaccine with lovely Katie.
Hi, Ayele. I'm Katie Saavedra. I'm an adult medicine physician assistant here at Mary Center, and I'm the medical director of the Ontario site in Adams Morgan.
Oh, well, it's wonderful that we get to speak about this today. First, discuss a little bit about the COVID vaccines that are available, and if you had any more information to share with us. But first, how these COVID vaccines work.
Sure, yeah. So COVID vaccines work in slightly different ways to help our bodies develop immunity to the virus that causes COVID-19. All of them work without making us sick with the illness, but help our bodies produce different immune cells that defend against the virus if we're exposed to it in the future. So it takes a few weeks after getting vaccinated with one of these vaccines for our bodies to start producing these immune cells. Two main vaccine types that most people are aware of are the mRNA vaccines, which are the Pfizer and Moderna. And then also there's the vector vaccine, the Johnson & Johnson one. And at Mary Center, we are offering all of them in different locations at different times.
Wonderful. And a lot of questions about this being the first time that the mRNA vaccines are being used and how fast they were developed. Could you perhaps touch on a little bit more about the speed at which these vaccines were developed?
Yeah, it's a great question and one I get a lot as well. And it may seem like these vaccines were developed quickly, but actually similar vaccines have been in development for years against other viruses, not COVID-19. Similar viruses. And the vaccines that are currently authorized in the US still had to undergo the full preclinical and clinical stages prior to becoming authorized for use by our FDA here in the United States. And they actually were tested on over 75,000 people, tested for safety, for how well they provoked an immune response, and for how effective they were. Since being authorized, they're still continuously monitored by the CDC, the FDA, and other independent committees for safety adverse events. So it may feel quick, but it's followed all the appropriate steps.
And you said that the COVID vaccine is the mRNA vaccine. So does this have any effect on our DNA or on our health in any sort of way?
It's a great question and one that we get a lot, actually. So these vaccines do not change our DNA. They use the vaccine material to make copies of a protein, which is part of the virus, and then our bodies quickly destroy the genetic material that's from the vaccine.
That's great to know. Thank you.
Mm-hmm.
And about how effective do you think that each of these vaccines are? Do you think that one might be more effective than the other?
Yeah, that's a good question too. So all three of these vaccines that I mentioned are highly effective, we would say, and substantially reduce the risk of COVID-19, especially severe or critical illness, like hospitalization or death. And although it seems that the three vaccines have different levels of efficacy or how well they work, it's sort of hard to compare the three against each other since they used different populations for their trials, or their trials occurred during different phases of the pandemic. And, as we know, this pandemic has changed so quickly and over time. So I think the best COVID vaccine is the one directly available to you, or as soon as it can be available to you, right? I don't recommend one over another. They're all really effective.
Wonderful. And as you said, that the vaccines were tested at different times, when there were also different variants of COVID out, would you say that the vaccine would be effective against these different variants that that have been popping up?
Yeah, that's a great question. This is becoming more and more of a concern, right? As this virus evolves and mutates over time, it's creating different variants. The good news is that these variants, so far the ones that we know about, seem to have the same, what we call spike protein, which most of these vaccines use to target. And so it seems that the vaccines will still offer a great amount of protection from these variants. These are early studies, but it seems that they're just as effective against the variant that's in the UK right now, and still effective against the variant that's in South Africa, although maybe a little bit less so than the original COVID-19. So this is all good news and evolving with time.
That's wonderful to hear. And I was also curious about, for those who have already had COVID and beaten it, whether they would have some of those spike proteins or whether it would be recommended for them to also get the vaccine as well.
Yeah. So if you've already had COVID-19, it's unknown kind of how long your antibodies or your protection against COVID-19 will last naturally. And studies are showing that vaccination for someone who's had COVID-19 in the past can actually further boost your antibody levels and might improve like how strong of an immune response you have and how long that immune response lasts. So as long as you're out of the window of being contagious, the 2-week window, or acutely sick, then it's definitely recommended to go ahead and get the COVID vaccine to try to have a longer lasting immune response.
That's wonderful. And so would you say that the vaccine would more prevent you from getting COVID, or, as you mentioned, the severe illness?
Yeah, since no vaccine that exists is 100% effective, we can't say that it will 100% prevent COVID-19 illness in every single person that gets vaccinated. There may be some breakthrough cases, but studies are showing that those cases are generally more mild illness, and that's the good news. It's definitely preventing mild illness in most people and severe illness as well.
That's wonderful to hear. And is there anything that you think would cause anyone to delay getting a COVID vaccine other than being in that two-week window?
There's nothing that would be recommended, where a medical provider might recommend that you delay it other than that, or perhaps a history of anaphylaxis to a COVID vaccine, right? Anaphylaxis is severe allergic reaction. It's extremely rare in general, but extremely rare against a COVID vaccine, right? So if someone were to have an anaphylactic reaction to their first dose, say, of a COVID vaccine, it would not be recommended to get the second dose. But other than that, there really are no contraindications, we would say, to getting the COVID vaccine.
Did you delay getting the COVID vaccine for any reason?
There is one reason where a medical provider might suggest that you delay getting a COVID vaccine, and that is if you received what's called monoclonal antibodies for a COVID-19 infection within the last 90 days. And that's a treatment that we give for kind of more severe COVID-19 or moderate to severe, which actually provides antibodies to you to help fight against active infection. So there is no need to get the COVID vaccine in the following 90 days. So that is a reason. An additional contraindication to getting the COVID vaccine would be if you had a severe allergic reaction to the first dose of the COVID vaccine.
Okay. And so, but you would suggest getting the vaccine even to those who have previously had COVID, and about how long after infection? Yeah,
absolutely. It's recommended to help improve your immune response and make it last longer. And you just have to be done with the isolation period. So 2 weeks, 10 days to 14 days.
Okay. So even for those who may have thought they had COVID but weren't sure, or unconfirmed COVID, they should still get this vaccine as well?
Yeah, that's a great question. Even if you never sought out a test or testing wasn't maybe available to you, as long as you're cleared from being isolated, or cleared from quarantine, no symptoms, definitely recommend it.
And also, how about for those who have any other type of allergies, chronic diseases like blood pressure, diabetes, or an autoimmune disorder? Would they be recommended to get this vaccine at this time?
Yeah, it's a great idea to speak to your primary care provider about any allergies or chronic diseases that you might have and any concerns that you might have about that. But it's definitely recommended that any individual with chronic medical problems, immunocompromising conditions, or even allergies take the COVID vaccine. If you have a history of severe allergies, anaphylaxis to other things, you will be monitored for 30 minutes after getting the vaccine rather than 15. We monitor everyone for at least 15 minutes after getting the COVID vaccine. So, your medical provider will suggest additional precautions for you.
Especially for those populations that would be at higher risk for more complicated cases for COVID as well. That's wonderful to know that they could get the vaccine as well. And how about for pregnant or breastfeeding participants that may be interested in the vaccine?
Yeah. So we're definitely recommending it at this point to pregnant or breastfeeding women. Since none of these vaccines contain active virus, they can't cause illness in pregnant women or babies through breast milk. We have seen studies show that antibodies can actually pass from the mom to the baby, which is great and exciting, both before birth and through breast milk. So that can help protect the baby as well.
So they don't call it liquid gold for no reason. And when to receive it, do you have to pay, or are there any costs to get it for the patient?
No, it's completely free.
And does any sort of documentation status or citizen status affect your ability to get it?
No.
Get it? No. And do you think that it would be mandatory to receive the vaccine in any case?
At this point, it's not mandatory, but it may be required in different settings, like at your work or at your school. Sports teams may require a vaccine in order to participate in the future. This is something that's going to be changing as it becomes more available and approved for a greater amount of the population.
Wonderful. And so what would somebody expect to happen at the vaccine appointment? How would that look like?
Yeah, it's a great question. So when you arrive for your vaccine appointment, you'll get a piece of paper or maybe an electronic version of a fact sheet that tells you more about the specific COVID-19 vaccine you'll be getting that day. You'll be asked a series of questions about your medical history, any allergies, any concerns you may have. You'll be offered to speak to a nurse if you'd like. And then after you get the vaccine, which it's given in the upper arm, you'll be monitored for 15 minutes just to make sure that you do okay, that there's no immediate allergic reaction. They'll provide you with a vaccination card. I'm sure everyone's seen the pictures of these on social media. And if you got the Pfizer or the Mrna vaccine, you'll be given a date to return for your second dose. The Pfizer one is 3 weeks later, and the Mrna one is 4 weeks later. The Johnson & Johnson vaccine is just one dose, so you'll be done on that day.
Okay, wonderful. And you said that there would be a paper with more information on it, but also that we would be waiting for 15 to 30 minutes after to look out for any side effects. Are there any side effects that we should look out for during that time or after, or even after that time when we go home from the vaccine?
Yeah. There are some pretty common mild side effects. And they're actually good news because it means your immune system is working, right? It's just signs of your immune system working. So, on the arm where you get the shot, common reactions are pain in that area for a few days, and sometimes maybe redness or swelling in the area. Throughout the rest of your body, you may start to feel tired, have a headache, maybe some muscle soreness, even getting a fever, chills is normal. And it just means your immune system is working. These symptoms can last 1 to 2 days. And you can always take a medication like a fever reducer like Tylenol or Advil if the symptoms become really bothersome.
And do you know of any long-term effects of maybe the vaccine, but also for COVID, longer-term effects that can be seen?
Yeah, so studies have not shown any long-term effects of the vaccine at this point, other than immunity. However, you're right to say that there continues to be more evidence of a syndrome that we're calling long COVID, or sometimes patients who have it are called long haulers, right? So if you get COVID-19, and it doesn't seem to matter if you had a mild infection or a more severe infection, you may have persistent physical symptoms for months afterwards, like feeling really tired, having chest pain, persistent shortness of breath, or even cough. A lot of patients report like feeling a little more depressed or having some changes in their memory, or what they're calling brain fog, like difficulty concentrating. And these all seem to be persistent symptoms of the COVID-19 infection.
So that's a big comparison, the long-term effects of COVID,
Yeah.
the vaccine.
Yeah.
And for how long does the immunity for the vaccine last?
So we're still learning about that. The good news is that at 6-month follow-up after the trials, people still had a really robust antibody presence or immune response. So they are developing booster shots, but we still don't know when or if they'll be needed.
That's wonderful. And after getting vaccinated, what can you safely do? Is it okay to go hang out with family, or what precautions should we still be taking after getting vaccinated?
Yeah, it's a good question. This is changing all the time, right? So as of today, in the US, the CDC has acknowledged that fully vaccinated individuals may not need to wear masks outside or in certain indoor settings with other vaccinated people unless they're being required to by local governments or employers. Masks still required on transportation like airplanes, buses, trains, in transportation hubs like airports, in all healthcare settings like doctors' offices, and may continue to be required in schools and in certain businesses depending on local law. But it's important to remember that you're considered fully vaccinated 2 weeks after completing the vaccination series. So for Pfizer and Mrna, that's 2 weeks after the second dose, and for Johnson & Johnson, it's just 2 weeks after the dose.
So during that time, the 2 weeks after, to still mask and take all recommended precautions.
Yeah, exactly.
And how about those 2 doses? Should they be from the same place? Can they be from different places?
Yeah, it's best if you can return to the same place, because in general we're kind of saving one for you, right? So if you get your first dose at Mary Center, it'd be great if you could please return to Mary Center for your second dose.
Wonderful. And so no Mrna for the second one, Pfizer for the...
Yeah, and it to stick with the same vaccine unless, unforeseen circumstances. But no, it's really only approved to have 2 of the same and in the same place, preferably.
And is it recommended to still get tested after receiving the vaccine?
It's actually not recommended. Even if you have an exposure to COVID-19 after being fully vaccinated, if you don't develop symptoms, there's no need to be tested. However, you should always get tested if you have any symptoms of COVID-19, whether you're vaccinated or not.
That's wonderful to hear. So I've heard some rumors that being around vaccinated people can cause effects in unvaccinated people. So do you think there are any truth to these rumors, or what would you might suggest?
Yeah, it's a great question. I've heard the same rumors, and there are no studies that have shown that a vaccinated person can somehow spread effects, locally to an unvaccinated person. I know there's been a lot of fears around fertility concerns in this regard, or somehow affecting someone else's hormones, and it's just not true.
Do vaccinated people need to distance from unvaccinated people?
And so it's still recommended that unvaccinated people wear a mask and socially distance in basically all indoor and outdoor settings. However, fully vaccinated people can gather with unvaccinated people, especially if they continue to follow all the guidance about social distancing.
Okay, that's wonderful. And during this quarantine time, or during this time of this pandemic, I feel like we all were hyper aware of disease transmission and infection control. So what lessons and practices from this time do you think we should hold on to or keep practicing?
Yeah, that's a great question. I think, what's been so interesting is how low our flu season was, and, how kids really didn't get super sick with winter colds this year. And I think a lot of it has to do with how well we were wearing masks all winter, and washing our hands, and just being really conscious about that. So I hope that we can continue to use those practices and precautions, annually in some form, and certainly here at Mary Center, to help keep each other healthy.
Well, thank you so much for that. And thank you so much for all this wonderful information, and for answering all these questions.
Sure. Thanks for having me. It's great to talk to you.
Great to talk to you as well. Take care.
You too.